Please reach out to your professors in the event that there are questions or concerns about a concept. You can send an email. We can jump on Zoom with you. We can even talk over the phone. Just please contact your professors in the event that there are questions about any concept for this upcoming exam. Be sure to have your two devices, your chargers, your identification. If you're going to use a dry erase board, make sure you have that as well. And then be sure to complete the practice exam, which will be available prior to the exam too. We just want to ensure that your devices, the specifications meet exam solve specs so there aren't any problems on the day of the exam. So rural health and migrant health. Just consider for rural health, the population, how the buildings, the structures, how they are located. Things are spread out for the most part. There aren't that many industries there, large companies, and therefore, with that being said, there might not be, for the most part, hospitals that are readily available for people. There might not be urgent care centers, specialty care. So it's like a domino effect. While they may have, all this space to accommodate these things, but the areas have just not been developed. So that will lead to a healthcare need. That means that there are barriers in the rural areas. So, for instance, if a patient, usually they do have a healthcare provider, they do have some doctor's offices there, but the hours are just the general hours. There's usually no after hours care. In the event that there's an emergency, like I said, the community members will have to travel to that next town just to receive that emergency care and also that specialty care. But what you do find now is uh, healthcare providers, especially like those specialists, what we're seeing now, they're trending to at least coming to the areas, and even if it's only one day a month, they're coming to the rural areas to at least make that care available to some of the community members. While they can't see everybody on that one day, but we are seeing that trend. Clients who live in rural communities know each other and they're very familiar with each other, because it's usually not that many. Everybody knows everybody is usually how they say it. And there's a lack of anonymity among rural community, which makes reporting health issues a challenge because people are afraid that, because the nurse may also be the family member, may also be the friend of the family member. It's just a small town, and everyone is familiar with each other. So community members or patients, they're far less likely to report, for example, sexual assault, drug use, or depression based on these concerns that someone will find out. So that's another issue about that rural area, lack of access. And then everybody knows everybody for the most part. There's also that transportation piece. Usually there's not public transportation is usually not available in those areas. And so as a result of that, we said we have lack of healthcare facilities, no urgent cares, no hospitals. They have to travel to the neighboring towns. There's no specialty care. There's usually everybody knows everybody. There's that lack of anonymity and also lack of transportation. And so collaborating with community resources to provide mobile healthcare services to help addresses is going to be key. I know, like in our area, there are some community resources, mobile units or resources that will travel and take patients outside of what they call outside of the service area, meaning they can take them to neighboring towns and cities. But what happens though when they do that? So, say for instance, you have a patient that that requires specialty care in the next town over. That ties up if we have a mobile service unit, a transportation service, that will tie up that transportation service for that entire day for the most part. So think about those people that are inside the county or the community that needs transportation within. So if that transportation company is tied up for that day, taking that person outside of the area, then so how many people would not receive or be able to get transportation um, for that day? So transportation, lack of specialty care, it would, just being afraid that everybody knows everybody and someone that lack of anonymity that someone will find out if in the event that something happened. If they have a cold, it could be afraid to go to the doctor's office. You know, my relative works at the doctor's office. My relative is the doctor. And so around so for example, in rural areas, sometimes if they were to have family dinner, for the most part, someone from each entity, emergency care, for the police department, from the doctor's office, the vet, for the most part, everybody's going to be at the family dinner. So then, like I said, that's that lack of, they're afraid of that lack of privacy that everyone will find out. So while we're in the community and we are doing our windshield survey, as we talked about last time, and as we are establishing those therapeutic relationships, implementing various interventions in the community, we want to identify effective interventions, because we want to decrease or reduce barriers from people receiving the health care that they need, because it's rare that someone don't want to take care of themselves. It's just that they don't have the means or resources are not there, or they haven't identified the resources that are there so that they can improve and maintain their health. So it's going to be very important that we, establish those therapy relationships of those community members, establish those community partnerships, and so that we can move forward with our interventions. We're going to talk about our levels of intervention here in just a few here. So going back to the migrant health. So we do think about their working conditions. And so what do they do for 10 or 12 hours or even maybe even longer a day? Just think about their day-to-day tasks that they have to complete. The migrant workers, for the most part, do a lot of bending and lifting. Um, their exposure to pesticides is way higher than normal, because remember, the farmers are trying to keep their harvest so that they can harvest. They're trying to keep their crops so that they can harvest. So they've identified chemicals and things or pesticides that they can put on there to assist with that. So the migrant workers more than likely are going to complain of musculoskeletal issues because of that lifting and bending for those extended hours. They may even complain of crowded living conditions, because for the most part, remember, they're just coming there to complete that harvest. They're coming to harvest, and so they're not staying there like year round. So um, they so for example, the farmers may offer housing But sometimes the housing, because it's not utilized year round, may be in poor condition. But people may say, well, hey, I'll just risk it because I'm only going to be here for 2 weeks. So there, that could lead to an increased chances of, for example, if we have a stomach virus outbreak, it more than likely will increase the risk of someone that being spread because of those crowded living conditions. In the event that someone has tuberculosis, that crowded conditions, it increases the risk of it being spread. Also, because the farmers are exposed to the pesticides, they need to ensure that they're wearing their protective gear, and then when they're returning home, that they remove that so that, if in the event that they brought their families with them, that they're not spreading or exposing their families to those pesticides. Okay. Because sometimes the migrant farm workers might bring their children with them. So as young as 12 to 13 years, they can work on a farm but if a farm has fewer than 7 full-time workers, children may need to work for the family's economic survival. So the child may be there, but this puts this child at risk though, for being exposed to pesticides, and this child not growing up and developing those social skills because they're tired from working. So they may not go outside and play like the rest of the children because, like I said, they're tired from working. So you might have children there as well. But children, they can work on those farms, if they're of age, and it's seen because that brings in extra income for that family. Okay, let's see here. Oh, I haven't talked about the mental health care part. So community mental health providers are working. They're trying, and this is in all communities, not just the rural communities, trying to prevent or decrease youth violence. So you will see an increase in, we've seen an increase in partnerships being established, collaborations, coalitions, providing in their target is increasing and strengthening those social skills so that those children will learn to stop and think about what they're going to do before they actually do it, because it's we had the pandemic, so there was a decrease in socialization. So what, like I said, what we're seeing now is those increase in partnerships. um just in the area, they had a church where they just had a youth thing. Parents dropped them off, and it was, they had their panel. They brought of course adults were there, but it was all pretty much youth focused. And you do see, like I say, those coalitions and partnerships being established because they want to, they know that if we improve those soft skills, those social skills, then it just dominoes to better outcomes, decrease in youth violence, decrease in motor vehicle accidents, decrease in substance use. It's just a win-win if we can improve those social skills. So we do want the pregnant teen to finish their education. So you will see the hybrid schedules and offerings for the pregnant teen. So their seat time, they may have online learning, they may have self-study, self-guided learning, but they have developed programs now, especially since COVID. They really have it for just in general, not only just for the teen mothers. They're developing programs, and I've seen it too a lot in the area with some children that have mental health disorders, ADHD, where they've created like these hybrid programs so that these children can complete their education. Because there's a direct correlation between education and poverty. There's a direct correlation, and so it's really important that we, have it so have the opportunity available so that the children can complete their education. So because the teen is a teen and their bodies are still developing, there's a teen pregnancy, then they're considered as high risk. They're high risk OB clients. They're high risk for being unhoused. They're high risk for being exposed to um, as a result of being unhoused or homeless. High risk for just being exposed to just factors, being out in the cold, having limited resources. Remember, our vulnerable populations are going to be those that are the young and old, but if we had to decide between the young and old, it's going to be the child. Okay. The child is going to be the one that is um, most vulnerable. So going back to that teen mom being high risk, that child, that baby is going to be high risk for low birth weight because that child that might not be eating nutritious meals, they might not even have access to nutritious meals. So that baby is going to be at risk for low birth weight, preterm delivery. And so they do have we want to identify those community resources that are available for them. I know there's several in the area. There's some that as the person, as the mom is in the pregnancy, they have programs that assist them along the way. They do like the parent teaching classes, and it's real in depth. And then even after it, after the mom delivers, there's other programs that work with them, and their focus is on them completing their education, and then having the resources being available so that mom can take care of that child. They help with job placement, with even the essentials like having diapers, car seats, just an array of things. There are several programs in the area. So partnering with uh, the local health departments and organizations is going to be essential. Okay. So let's talk about the levels of prevention. Primary focuses on prevention, prevention, prevention. So how do we do that? We provide education about whatever it is. Education about sexually transmitted diseases, education about sun exposure. It's providing the education because we want to prevent whatever it is from ever happening. Education about wearing your seat belts, by wearing helmets, riding bicycles, but it's education. Secondary level of prevention focuses on screening. We're trying to screen, detect, or determine if there is an injury there, if there's a disease process there. And then tertiary level focuses on treatment and evaluation of the outcomes, trying to maintain and help that person manage their disease process. So these levels of prevention, you know, even it's education, screening, or helping that person manage. That's implementation. Remember the different parts of the nursing process. Those levels of intervention falls on the implementation. We're implementing, we're doing um, whatever those plans are for that patient. Remember, OSHA is, when we talk about OSHA, it's the Occupational Safety and Health Act. The purpose is to ensure safe and helpful working conditions. Safe and helpful working conditions. We want to, because depending on the workplace, there are all different types of hazards that are there. And so it's going to be, if you're working in the industry, well, even if you're at the hospital or urgent care, this can be an additional task where, like a QA, where it's an ongoing process where they identify all types of hazards and just to make sure that those things are addressed. This ensures a holistic approach to workplace safety and risk management. You can be on that team. Now, there are some facilities that do have um, a team, a risk team, but for the most part, you see it as an additional task uh, for like the charge nurse or the supervisor. But the whole thing is we want people to come to work, be able to do their jobs and be safe. We don't want people coming to work and, getting injured. Let me go back to the levels of prevention. So, delivering primary prevention is education, is promoting health, and we want to prevent the problem, prevent something from happening in the first place. So, we're attempting to avoid or prevent an injury, a disease, or harm. Education is key. So just think about that. Like I said, I gave a different examples. It could be providing education about safety equipment, about healthy snacks, um, just an array of things, but we're providing that education. Secondary prevention involves screening for the disease or detecting the disease at its earliest stage possible. So we're advocating for certain tests to be available. So one I could think of one study, and that was their whole focus. They did like this 3 hour intensive um of numerous exams, and they looked at, for example, they measured height, weight, they did echocardiogram, CT scans, and these were just done to screen or detect whether or not there was disease process there. These were not ordered by their doctors, but this was this whole focus of this project was to identify, uh, to determine if there was disease at its earliest stage so that it could be addressed. And this allowed for timely intervention. And think about it, you know, a lot of times when someone finds out that something's wrong with them is later in the disease process. So screening, secondary prevention reduces long-term health effects because it's identified in a timely manner. Okay. So tertiary prevention aims at rehabilitation, restoring, managing people, trying to get them back to their highest functioning level. You know, for example, if someone breaks an arm, provide and giving them instructions on cast care, making sure that they follow up for their appointments because that person won't needs to have that arm functional, that bone needs to heal. So that rehab, that restoring. The tertiary level of prevention is focusing on minimizing complications. Is intended to restore health as fully as possible to assist individuals to achieve their maximum level of care here, of function. Right. So the faith community nurse, we are in a place of faith and they're autonomous. It just depends on what that place of faith focus is. So you see a number of programs. It might be nutrition information that you provide. It might be exercise programs that you're actually providing, but it is whatever that faith-based community, what their focus is. So you're autonomous. That's one of those environments, you do whatever just based on their guidance here. So we talk about this triangle here. The epidemiological triangle consists of the agent. The agent is going to be the pathogen. It is that bacteria, that virus, whatever is causing that disease. The host is going to be that affected individual. And then we have the environment, and that those conditions facilitate, increase disease transmission. So we got the host, the person, the agent, what's making the person sick or invading that body, and then the environment. Are those conditions um, favorable for an increase in disease process? So, friend, yes. So, as a nurse, we identify multiple potential environmental risks: lead, water, food, affecting individuals in those communities. Okay, our primary interventions will be focused on reducing those exposures. We need to educate the patient, the family, not the family, the community members. We need to identify the exposures, educate the people that live in the community, and then we need to collaborate and partner with those healthcare agencies, the health department, whatever agencies are there to assist with cleanup. Because I can think a couple of years ago, it seems like, I don't know, every week like trains were derailing, and the carts that were derailing had these toxic chemicals in them. So think about it: if those trains derailed and those chemicals were spilled in people's yards, what if there was a waterway? So we had to identify if there was an exposure, and then we had to work with public agencies to clean up, to lessen the chance of those waterways being affected. Because we know, once that water got into an individual, then um, that person would be harmed. Okay. The nursing and occupational health, for the most part, you see this trending everywhere. They have the industries, they have a whole healthcare team. And so you do want to consider what the tasks that they are completing, just like we talked about the migrant farm worker, they're doing lifting and bending. Consider the tasks that they are completing in those industries. We might even have to go out and visit their workstation, especially if we're seeing um, a huge number of employees coming from one section, because it might be that the equipment is malfunctioning. It could be that they need to be taught to complete the task. And so we might have to actually look at that workplace, that station at that workplace that they're coming from. Because remember, we talked about OSHA, that workplace safety. We want to ensure that. So let's talk about we're gonna go back. We kind of started talking about these healthcare agencies in weeks 1 and 2. But remember, the Centers for Disease Control, the CDC, is responsible for monitoring health, detecting problems, and implementing preventative strategies. Okay. Then we have the National Institutes of Health. Their focus is on research. And then we talked about the Agency for Healthcare Research and Quality. It is responsible for improving quality and safety of healthcare through measuring quality indicators. So like I said, we started talking about that in weeks 1 and 2. But in addition to, all of your exams do have your math problems on there, your dosage and cal. So make sure that you review that. Reach out early on. Go back to your Canvas and look for uh, the exam review schedule. We post it early on. So go back through that and see what dates and time. I think there's 6 or 7 of us, so there are a variety of dates and times. But at a minimum, commit to going back through your classroom recordings, attending the exam reviews. And when you attend, make sure you're putting your name and campus in the chat. Make sure that we usually provide the links from the exam review. So make sure you're taking the time to go back through all those recordings. And you can chunk it up, like do small segments of those reviews, and then reach out to your professors early on. Also, remember I said you can reach out through email. We can jump on Zoom. You can even speak over the phone.
Thank you.
You're welcome. Happy learning.